Welcome, everybody. Thank you so much for joining us this afternoon. I hope you learned as much as I did from all the individuals who shared their experiences. Sorry, my video was off. You made today awesome. Right? Thank you also to all the panelists and the members of Team Turing. I wanted to call out a couple of great remarks from our panelists today. These are things you can take to the bank as you grow your remote workforce. Hital Shah from Uber says, trust your employees, focus on outcomes rather than activities. That's great advice. Kintan, GM from Amazon, says, invest as much time as you can in onboarding. Use great documentation to make it easy for new hires to access the rhythm of an organization. I agree a ton with Kintan's emphasis on onboarding. Kintan has observed one shift in the way onboarding works in the era of remote-first organizations. In the old days, when you were onboarding, you would probably go to your manager for everything. Now, it's actually better, a much better approach is to write everything down so that people ramping up know for which specific questions to go to which specific stakeholder. I can't stress enough how crucial a rigorous onboarding process is for starting new people off on the right foot. Aditya, an engineering manager from LinkedIn, reminds us that when everyone is remote, team bonding must be deliberate. Remote teams must learn how to combine their strengths to work together. This is a theme that came out in quite a few panels, like about how intentional you must be in building those personal relationships when we are fully remote. And finally, Heather McElvey, a LinkedIn VP of Engineering, had this sage advice. If you're going to maintain high performance, you have to also maintain the ability to let go, relax, and turn off. Heather also pointed out that you might be, as you're continuously raising the bar, take some time off from time to time to pause where you are to celebrate your successes before raising the bar again, versus continuously raising it all the time, which could burn people out. Now, for all of us, the future is still unclear. A lot of people love working from home. A lot of companies have discovered that for them, remote work works. Is the office a thing of the past? Not entirely, not yet anyways. For Turing and for many of our partners, the new default will be to work from anywhere plus meet as needed. I think the future of work is going to be work from anywhere plus meet as needed. I think the default will be work from anywhere. The default will not be an office. I see many approaches to work and company structure on the horizon. For startups and many companies, I'm convinced that remote first is the way to go. The advantages are far too many. You have huge advantages in attracting great people. You have huge advantages in cost savings. You have huge advantages in just quality of life for your people. Like the one fun thing in all these panels is it sounds like employees in almost 100% of the time want remote work or something very close to remote work. It's some subset of managers who I think are a little bit nervous. And I think the advantages are too much. I think the new default is going to be work from anywhere plus meet as needed. I anticipate that many companies will choose to have remote by default and maybe come into the office 1 or 2 days a week and maybe have some one-on-ones in person, do quarterly offsites that bring people together. Working from anywhere doesn't mean you never meet. It's just that the default is that you work from anywhere. And there's just so much savings in terms of commute and time. Like most people waste like 1 to 2 hours a day commuting. We're not going back to that. The future of work is bright. The future of work is remote first. And as we wrap up, I'm also talent cloud as a new category. I want you to sort of pay attention to the term talent cloud because you're going to hear about it more and more. The old way of the offices is dead. The new way is either a remote first or a remote friendly culture where we might have a small physical location, but a much larger percentage of the team working in the cloud from wherever people may choose to live. You're going to see this more and more. And you heard about Turing's latest product updates as it relates to our self-serve system. You heard about updates to Turing's deep developer profile. And you heard about Turing's use of artificial intelligence for improving our vetting, improving our matching as we scale the talent cloud for engineering. This was such an awesome day. Thank you all for joining me. And as we wind down the day, I want to take a few seconds to reflect on the broader the broader situation with COVID all over the world. Countries like India and Brazil are in a very grave situation right now dealing with the COVID crisis. I know a lot of us are figuring out how do we help. Like we hear about these crazy graphs with COVID in India, and I know a lot of us are worried because we have friends in India, we have family in India, we have coworkers in India, and we're all figuring out how we can help. And I've been doing that research as well. Like, how can I donate? How can I contribute in a way that makes that has the maximum impact? And to do that, I'd love to introduce my friend and mentor, Ashu Garg. Ashu is a GP at Foundation Capital. Ashu was also one of Turing's first investors and a board member. Ashu will share more about OneMoreBreath, which is an initiative that he and a very talented team of execs based in India and the US are working on to save lives in India that are impacted by COVID. Ashu, I'd love to bring you on stage.
Hey, Jonathan.
Hi, Ashu. Go ahead, Ashu. You can.
Okay. Hi, everyone. My name is Ashu Garg, and I'm a general partner here at Foundation Capital, an early-stage venture capital firm, and one of the founders of OneMoreBreath. And I'm here today to ask for your help in saving thousands of lives in India. Many of the folks in Turing have been amazing in the help that they have provided us, and I'm hoping that many of you in the audience will join them and help save lives in India. So, as you probably already know, India is experiencing a severe COVID-19 crisis. You've probably seen the news about the fact that the number of COVID infections is accelerating at a rapid pace and that thousands of people are dying. What most people don't realize is the scale of the tragedy. Unless we act immediately, more than 10,000 people will die every day. More than 25 people would have died by the time I finished speaking to you. Many of the people dying are parents and breadwinners for their families, and their deaths will set entire families back by a generation. We all have friends, family, and co-workers in India. And many of us, and I suspect many of you, have been asking the same question. What can we do to help that will drive the most impact? Pooja, my wife, and I asked ourselves the same question. And after researching many options, we decided to set up field hospitals with oxygen support. Our hospital in a box model enables us to set up field hospitals for less than $1,500 per bed. And each bed will save more than 20 lives. For just $100, you can save a life and a family. If you're wondering why set up field hospitals versus shipping oxygen concentrators to India or the myriad of other ideas floating around on the internet, the answer is simple. In India, it's always about the last mile, and that's our focus. Too many oxygen concentrators are sitting idle on the tarmacs of Delhi Airport. We will make sure that oxygen concentrators are actually put to use in the field and that there are beds, pulse oximeters, nurses, doctors, and all the other things that are required to care for patients in small towns across India. My co-founders in this project are my brother Neeraj Garg and my wife Pooja Malik. Neeraj has 20 plus years of healthcare experience in India, and he lives in Bombay. He's been the COO of several large pharmaceutical companies, including Abbott Labs, the CEO of one of India's largest hospital networks, Apollo Hospitals, and is now the regional director for Eurofins, a global testing services company, and has been actively involved in the war against COVID for the last year in India, building out COVID testing labs across the country. Pooja, my wife, has worked with ICICI Bank in India early in her career, spent more than a decade at BlackRock running large hedge funds globally, and now runs her own hedge fund, Nippon Capital. The approach we have pulled together over the last month is unique on 4 dimensions. First, we're focused on augmenting and scaling existing hospitals, leveraging existing hospital infrastructure, leveraging existing trained manpower. We're focusing on hospitals that have COVID expertise. It also is driving the lowest cost per bed relative to a variety of other approaches that people are using to stand up new hospital capacity. The second, it's a holistic approach. We leverage all of the existing infrastructure. We provide all of the funds required to set up the hospital, hence the term hospital in a box. We get all of the equipment, including beds, including thermometers, if that's what they need, to the hospital, get it up and running. And then we partner with a local organization called Roundtable, which is one of India's largest nonprofits and has volunteers in 124 cities to provide on-the-ground logistics, ongoing support, project monitoring. Roundtable takes care of everything from meals for the patients, all the way to gasoline required for the diesel generators that you need to keep these concentrators up and running. We have the hospitals lined up. We have already, ordered the equipment. Pooja and I said we're going to provide bridge financing in addition to our sort of seeding this organization. And so we have paid for the equipment, and we have raised $1.2 million from some of the most notable venture capitalists and entrepreneurs in Silicon Valley, including Jonathan and others in the Turing family. We now need to raise another $800,000 to get to the finish line and set up the 1,400 hospital beds we need to save 28,000 lives. Every $100 will save more than one life. And every $1,500 hospital bed will save at least 20 lives. We need to act now, and we need your help. How many lives can you save today? Please go to OneMoreBreath.org. That's OneMoreBreath.org to learn more and donate today. And please help us spread the word. Thanks, Jonathan, for the opportunity.
Thank you, Ashu. And Ashu is one of the smartest, most data-driven people I know. And I love that Ashu and his team have spent the last couple of weeks researching what's the biggest the highest impact way in which to contribute to help with saving lives in India. Some of the numbers that stood out to me was it only costs $1,500 to set up a bed with oxygen and about $100 to save a life. So I encourage everyone who's able to consider donating, and it doesn't matter what the amount is. Maybe it's $10, maybe it's $100, maybe it's $1,000. Whatever that is, I encourage you all to consider donating. OneMoreBreath.org, and encourage you to also do what you can to help a lot of these other countries that are also struggling. Brazil is also struggling. For Turing, this is very close to us because we have a lot of developers from countries like India, Brazil, etc. And we are doing all we can to help. OneMoreBreath.org, that's a very good way in which you can directly help save lives in India. Thank you, Ashu, for taking the time and spending all of your energy on this.
Thank you, Jonathan, and thank you to everyone at Turing. You've been a fabulous partner in this journey.
Thank you. All right, and that is a wrap, everyone. So this was a great boundaryless event. We'll be sharing all of this on Turing.com and on our social media channels. If you don't already do this, follow Turing at Turing.com, and we'll see you at our next event. Thank you. Bye-bye.